Hi everyone, this lesson is on prostatitis or an inflammation of the prostate gland. In this lesson, we're going to talk about the different types of prostatitis. We're also going to talk about the causes of prostatitis. We'll also get into the signs and symptoms, how it's diagnosed, and how it's treated. So what is prostatitis? If we were to actually look at the word prostatitis, the prefix prostate refers to the prostate gland, and the suffix itis refers to inflammation. So prostatitis is a urological condition involving inflammation of the prostate. Now, we're going to get more into this later on in this lesson, but there can be infectious or non-infectious causes of prostatitis. Now, the epidemiology of prostatitis shows that it is a relatively common condition. Prostatitis may affect upwards of 10 to 12% of the male population. And there are two age groups that are more likely to be affected by prostatitis. These include younger men and older men, and the middle-aged group is less likely to be affected. And this is going to come down to some of the risk factors we're going to talk about. One of them is anatomical structural abnormalities. An example is bladder outlet obstruction, and more specifically, we can see this with an enlarged prostate. So this is the reason why prostatitis is more prevalent in older male populations, because they're more likely to have an enlarged prostate. So it can either be benign prostatic hyperplasia or BPH or prostate cancer. And then some other causes that can lead to a bladder outlet obstruction can also lead to prostatitis, and these can include kidney stones, where a kidney stone might become lodged within the urologic system. Now, some other anatomical issues may also increase the risk for prostatitis as well. Urinary tract infections can also be another risk factor for getting prostatitis. Another risk factor is unprotected sexual intercourse. Another one is indwelling catheters. So the plastic of the catheter can be used by bacteria to essentially crawl up through the catheter, through the urethra, and can infect the surrounding areas, including the prostate gland. So this can lead to inflammation of the prostate. And then immunocompromise is also another risk factor. So anything that is causing immunosuppression, this can include immunological conditions like AIDS. This can also include things like diabetes or older age. So anything that's going to suppress or reduce the immune system functioning can increase the risk of infections in general, and one of them is going to be prostatitis, or an inflammation of the prostate gland due to an infection. Stress can also be lumped in with this risk factor as well, because stress or prolonged stress can lead to immunosuppression as well. Now let's talk about the different types of prostatitis. There are actually 4 types of prostatitis. The first type is type 1. This is going to be an acute bacterial infection, and this is also called acute bacterial prostatitis, or ABP. Now, because type 1 prostatitis is an acute bacterial infection, it is caused by an ascending urinary tract infection. So the bacteria that cause the urinary tract infection essentially climb up the urethra and infect the surrounding areas, including the prostate gland. So this leads to type 1 prostatitis. Now, the causative organisms of type 1 prostatitis include the following. E. coli. Now, E. coli is actually the most common causative organism, but we can also see other gram-negative bacteria, including Klebsiella, Enterobacter and Enterococci bacteria, Proteus and Pseudomonas, and Serratia. And the way to remember these bacteria is by the mnemonic KEEPS organisms. So KEEPS, or KEEPS. So K for Klebsiella, E for E. coli, E for Enterobacter and Enterococci, P for Proteus and Pseudomonas, and S for Serratia. And then some other organisms that can cause type 1 prostatitis include Neisseria gonorrhea and Chlamydia trachomatis. These are sexually transmitted infections, and this is the reason why unprotected sexual intercourse is a risk factor for getting prostatitis. Now let's talk about type 2 prostatitis. Type 2 prostatitis is a chronic bacterial infection. It's also known as chronic bacterial prostatitis, or CBP. Like type 1 prostatitis, type 2 prostatitis is caused by a bacterial infection, but more specifically, it's caused by recurrent urinary tract infections and oftentimes caused by a previous acute bacterial prostatitis, or type 1. So oftentimes, patients who have had type 1 prostatitis, if they're not treated properly, may go on to having type 2 prostatitis. What happens if they do have type 1 prostatitis is that the bacteria that have seeded in the prostate gland may form bacterial biofilms. Biofilms are these gelatinous structures that the bacteria use to adhere to tissues like the prostate, but are also used as a form of protection from things like antibiotics and immune system attacks. So the bacterial biofilms essentially protect the bacteria from becoming destroyed by antibiotics or the immune system. So oftentimes what we can see is that type 2 prostatitis, prostate gland has been seeded with bacteria that have formed biofilms. Now let's talk about type 3 prostatitis. Type 3 prostatitis is actually the most common type of prostatitis. It is a chronic sterile inflammation or chronic pelvic pain syndrome. It is sterile because there are no bacteria. Bacteria do not cause type 3 prostatitis. So what does cause type 3 prostatitis? It's actually caused by a reflux of urine within the prostate gland. So this leads to the risk factor we talked about before, that bladder outlet obstruction. So when urinating, urine flows out from the bladder, out the urethra. The prostate gland surrounds the urethra and is located at the base of the bladder. If there's any tissue, for instance, if there is an enlarged prostate or if there's some stone in the way and the urine does not go out the urethra properly and there's reflux of urine, this can cause irritation. This can actually cause inflammation of the prostate gland, causing type 3 prostatitis. So this is the reason why type 3 prostatitis occurs. Again, it's the most common type of prostatitis, and types 1 and 2 are less common. They're actually rare. Now, there is also a type 4 prostatitis. This is asymptomatic inflammatory prostatitis. Because it is asymptomatic, there are no symptoms. So there may be some mild inflammation within the prostate gland, but there are no symptoms. So I'm not going to talk about type 4 prostatitis in this lesson. I'm going to talk about the other types. Okay, now let's talk about the signs and symptoms of prostatitis. We're first going to talk about type 1 prostatitis or acute bacterial prostatitis or ABP. The signs and symptoms of acute bacterial prostatitis have an abrupt onset. Because this is a bacterial infection of the prostate gland, it's going to cause a fever. The body's going to mount a fever to the infection. There's also going to be myalgias or achy muscles. And because this is an infection, patients often feel unwell. They feel ill, so they have malaise. And because type 1 prostatitis or acute bacterial prostatitis is caused by an ascending urinary tract infection, they are going to have what we call LUTS or lower urinary tract symptoms. These are symptoms of a urinary tract infection. So the signs and symptoms that we're going to see include the following: urgency, frequency, and dysuria. Urgency is the sensation of urgently needing to go to the washroom. You feel like you really need to urinate very quickly. Urinary frequency is the number of times you need to use the washroom increases. So the number of times you need to urinate increases in frequency. And then dysuria is a burning sensation when urinating. These are the symptoms of urinary tract infection, and these are the LUTS or the lower urinary tract symptoms. And then what we can see with type 1 prostatitis is pelvic pain as well. So pelvic pain can also occur in type 1 prostatitis. Now let's talk about type 2 prostatitis, CBP, or chronic bacterial prostatitis. It's going to be similar to acute bacterial prostatitis, except the symptoms are going to be more long-lasting. They're going to be chronic. They're going to be recurrent, so they're going to come and go, and they're going to be less severe. So again, the signs and symptoms are going to be similar to acute bacterial prostatitis. They're going to have a lot of those symptoms we talked about before, pelvic pain, some of those lower urinary tract symptoms, but they're not going to have some of those more acute symptoms like fever, the myalgias, and the malaise as much. So those are going to be less likely to occur in chronic bacterial prostatitis. Now, chronic bacterial prostatitis is going to have some additional signs and symptoms. These include pain during and after ejaculation, sexual dysfunction, and then subsequently it's going to lead to infertility. So in addition to a milder form of acute bacterial prostatitis, chronic bacterial prostatitis is going to have these additional signs and symptoms as well. And then type 3 prostatitis is that sterile prostatitis or chronic pelvic pain syndrome. It's going to have the same symptoms we just mentioned with chronic bacterial prostatitis, but it's going to have chronic pelvic pain. And that chronic pelvic pain is going to more specifically affect the penis, scrotum, and perineal areas. So because sterile prostatitis is not caused by a bacterial infection, it's not going to have those urinary tract infection symptoms. So it's not going to have that urgency, frequency, and dysuria we talked about before with regards to acute bacterial prostatitis. But it's going to have some other associated symptoms, including urinary retention, because oftentimes the cause of sterile prostatitis is that urine reflux we talked about before. And that is going to be caused by a bladder outlet obstruction. So if there's a bladder outlet obstruction due to an enlarged prostate, for instance, there can be issues with urinary retention or difficulty urinating at all. So the sterile prostatitis is going to have the chronic pelvic pain, as we mentioned before. It's also going to have these other symptoms that are found in chronic bacterial prostatitis, and it's also going to have some other associated symptoms like urinary retention. Now let's talk about the diagnosis of prostatitis. Some methods of diagnosing prostatitis include urinalysis, urine culture, and sensitivities. So because type 1 and type 2 prostatitis are caused by bacterial infection, bacteria can be detected with some of these methods. STI testing is also important to perform because Neisseria gonorrhea and chlamydia trachomatis are causes of type 1 prostatitis. A CBC or complete blood count is often performed as well. A transrectal ultrasound can also be performed to diagnose prostatitis, oftentimes in the case where bacteria are not the cause of prostatitis, so we may not detect them on some of these methods. A transrectal ultrasound can pick up an inflamed prostate, as we may see in type 3 prostatitis. Prostate-specific antigen can also be measured. So in chronic bacterial prostatitis, we may see elevated prostate-specific antigen. We may also see it in type 3 prostatitis as well. It's important to have a urology assessment and diagnosis. And there are a couple of other diagnostic tests for prostatitis, and these include the 2-glass and 4-glass tests. I won't get into much by way of detail of these tests. If you want more information, please read about these. And then it's also important to assess for costovertebral angle tenderness, or CVA tenderness, to rule out a pyelonephritis. As we mentioned before, type 1 prostatitis is due to an ascending urinary tract infection, but pyelonephritis, or an infection of the kidney, is also caused by an ascending UTI. So it's important to also rule that out as well. And then in some cases, there may be a need for imaging, especially in those who are immunocompromised. And this includes CT imaging for a prostatic abscess in those cases. So if a patient is immunocompromised, CT imaging may be required. Now let's talk about the treatment of prostatitis. So for acute and chronic bacterial prostatitis, certain antibiotics are utilized. The antibiotics that are used require coverage for the Enterobacteriaceae organisms. So these include the fluoroquinolones, macrolides, and tetracyclines. Now, oftentimes fluoroquinolones are avoided because of the risk for developing resistance to them. But in the case of prostatitis, fluoroquinolones may be used because the prostate gland tissue is different in the sense of distribution of antibiotics. Some antibiotics are not able to effectively penetrate the prostate gland, but these ones I mentioned here are. And fluoroquinolones are a pretty good choice for actually penetrating into the prostate gland tissue in order to treat those organisms. So these are 3 classes that can be used for these types of prostatitis. There are differing durations of treatment that are required depending on the type of prostatitis. I won't get into this in much detail here. If there is an abscess that is found, if CT imaging does find an abscess, surgical drainage is required. And for type 3 or sterile prostatitis, there is a different system of treatments for this condition. And this is called the U-point system. So U stands for urinary. So because oftentimes it's due to reflux of urine that causes inflammation of the prostate, alpha blockers like tamsulosin helps with urinary flow, which can help reduce urine reflux. So tamsulosin or Flomax can be used. We mentioned stress being a risk factor for actually getting prostatitis. So P in U-point is for psychosocial, and this stands for stress and anxiety management. O stands for organ specific. So this is more specific to the prostate gland itself. Quercetin or quercetin is found in a variety of vegetables, and this can actually help reduce prostate inflammation. The I in U-point stands for infection related, so this basically stands for antibiotics. So if there is a question of, well, perhaps this is sterile prostatitis, but there may be some bacteria that have also seeded the prostate gland, antibiotics may be used as well. N stands for neurologic, so some of the symptoms may be neurologic in origin, so pregabalin may be used as well. And then T stands for tenderness, and this is for therapy for pelvic floor muscles. So pelvic floor muscle therapy has also been shown to help reduce symptoms as well. So these are some of the methods of treatment for sterile prostatitis. If you want to learn more about other urologic conditions, please check out my urology playlist. And if you haven't already, please like and subscribe for more lessons like this one. Thank you so much for watching, and hope to see you next time.